Can a hospital be too clean? Could patients benefit from bacteria? Ed Yong is author of I Contain Multitudes, The Microbes Within Us and a Grander View of Life. He's also a staff science writer at The Atlantic Magazine, and he joins us now from Washington, D.C. for 10 questions on microbes and healthcare. And Ed, just to get this started, I want to do a couple of quotes from your book, and that will set up the first question. Here we go. Every time we walk, talk, scratch, shuffle, or sneeze, we cast a personalized cloud of microbes into space. This means that our microbiome isn't confined to our bodies, it perpetually reaches out into our environment. And yet a few pages later, you write the following: sterility is a curse, not a goal, and a diverse ecosystem is better than an impoverished one. These principles are the same whether we're talking about a human intestine or an aquarium tank or even a hospital room. So let's start there. Question one, have our hospitals become too sterile?
Possibly. We know that hygiene is important. We don't want people to pick up infections, but we also know that if we try and over-sterilize the world around us, we leave these vacancies for invaders to take up. And maybe those invaders are the microbes that actually are likely to cause us harm or ill.
Question two, what would the world's most famous nurse, Florence Nightingale, have us do to improve the healthiness of hospital rooms?
So Nightingale was a big fan of ventilation. She encouraged people to open windows in order to let air from the outside in, which seems a little bit weird when we think about hospitals, but it makes sense from this microbial perspective that I've been talking about. By actually letting environmental microbes into places like that, maybe you're crowding out the pathogens, the germs that actually cause disease.
Question three, are there people working on ways to make hospitals less microbially impoverished?
There are people who are certainly looking at the microbiome of hospital rooms and buildings and trying to understand what's there. How does what's there affect what's in a patient? And perhaps there are ways of seeding such buildings with the right microbes in order to prevent the wrong ones from taking hold.
Question four, how encouraged are you by the recent moves by the American Food and Drug Administration to ban antibacterial agents, including triclosan, from soap?
I think they're actually quite a good idea. We have waged a very extreme and some would say absurd war in the microbial world. We have gone overboard with sanitizers and antibacterial gels and soaps and so on. And the long-term risks of these products and of stuff like triclosan are still unproven. They don't seem to be any better than just regular soap and water, and they might have risks that we don't know about, not just to our microbiome, but to our own bodies too.
The number of cases of autism, of course, in the last decade or so seems to have exploded off the charts. And so for question five, I want to ask, how has studying the gut bacteria of mice suggested a possible treatment for human autism?
So some scientists have found that certain microbes, when given to mice that are displaying some of the same symptoms as autism, have reduced those symptoms, so made the mice sort of more exploratory, for example, or less likely to carry out repetitive movements. Now, what that means for human autism is unclear, because obviously mice don't have autism. This is a human condition that it reflects our social and cultural norms as well. But it does suggest that microbes may be influencing our behavior in relevant ways, and perhaps that's something that we can tweak and change.
Because, as you point out, mice don't get autism, I want to ask question six as follows. Some people are quite skeptical of the work because of that. Where do you stand on the potential of this research?
I think it's definitely worth following up on. I think we want to understand how microbes influence our brains and our lives, but I think we need to proceed very, very cautiously. You know, the autism community have had more than their fair share of misinformation and false hopes, so I think we need to proceed with rigorous evidence and sound science.
Question 7, a nasty acronym for you here. Fecal microbiota transplant, FMT. What is that?
So that is really exactly what it sounds like. It is a treatment that tries to improve people's health by implanting them with the stool from a healthy donor. You can do that through an enema or through a tube that's threaded through the nose or the mouth, which sounds deeply unpleasant, but it is very good at treating infections by a microbe called Clostridium difficile, or C. diff.
Question 8. It does sound horrible. Tell me why this has the potential of working.
It is like an ecosystem transplant. Think of it as a way of returfing a lawn that has been overrun with weeds, with fresh green pasture. And in this case, the weed is that microbe I mentioned, C. diff. And by replacing a community that's been overrun with C. diff with that from a healthy donor, you are evacuating that, you are curing that disease. And antibiotics can cure C. diff cases in maybe a quarter of cases, whereas fecal transplants have cured upwards of 90% of cases. It does seem to be by far and away the best treatment we have for this particular infection.
Fascinating. Question 9. I don't want to ask you about repopulating. I want to ask you about, you know what's coming, right? RePOOPulating. What is RePOOPulating?
Okay, so obviously fecal transplants are gross and there's an ick factor associated with them. So some scientists are trying to create cocktails of microbes without the fecal element that would be more palatable to people. Now, one of those cocktails has been called RePOOPulate, and it is a community of microbes that have been specifically chosen to try and give all the benefits of fecal transplants. And, you know, it's being tested. We still don't know if it works or not, but there are many such artificial bacterial cocktails that are in the works.
Now, normally they say don't try this at home, but for question 10, I want to finish up by saying that you point out that FMTs are so simple that actually anyone can do it at home. Do you know whether that actually happens?
Yes, there is actually a large community of DIY fecal transplanters, and partly they've been driven to do that because the technique is so unorthodox that a lot of people have been dismissed by the medical community when they've tried to ask for such treatment. So they've done it themselves. Now, I can understand the need for doing that, but I think as fecal transplants become more mainstream, the need to do so has become less and less. And actually, there are risks involved. When you do it in a hospital setting, people screen the donors very carefully to make sure they have no communicable diseases like hepatitis or HIV, or that they don't have conditions like obesity or inflammatory bowel disease that may pass along with the microbes. So it is really important to understand that this procedure has a lot of risks involved. It's not something that you should do lightly.
More on this and other subjects in I Contain Multitudes, Ed Yong's latest book. Ed, it has been thoroughly disgusting talking to you, but illuminating as always. Thank you so much for joining us on TVO tonight.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.